So, how can we address the current workforce shortage of direct care workers in nursing homes and assisted living residences and in home care? It's a big question, but we'd really love to hear your thoughts.
Well, it is a good question and one that we've been asking ourselves, I think, for a long time. It's not a new problem, but we're learning more about the issues and how serious they are with the pandemic. You know, the pandemic, COVID-19, has affected us across all of the settings that you mentioned. So whether you're talking about home care or home health, you're talking about nursing homes, assisted living, hospitals, the direct care worker, whether we call them certified nursing assistants in nursing homes or we call them home health aides or assistants in home health. The roles are similar. There are a few differences, but direct care workers are a critical element of our workforce. We could not deliver quality without them. And so the question becomes, if we have a shortage, why do we have a shortage, and understanding that. And so a lot of researchers and other folks who study and evaluate programs have said, well, one of the issues, if you ask certified nursing assistants, for example, who work in nursing homes, they will say to you, well, I don't really see an opportunity for advancement in my work. I don't see a way that I can continue to move up and do different things professionally in my role as a nursing assistant. And sometimes people say, well, do you want to go to nursing school? And some people say, yes, I do. That's great. We need nurses too. But we also need to have people who can continue to develop their skills and spend time with residents or spend time with patients in hospitals, because that's what they really love to do. That's what got them into the work to begin with. I think we do have to look at people. I'm one of those people. I started out as a nursing assistant, back in the late 1970s, and many of our colleagues also started out in that role. So we need to ask one another, why did we leave that role, or what did we like about that role? But it is important that we figure out how to create career ladders or lattices for people who are in this role. That's really what they're looking for. They also talk about the wages and the benefits being really low, and that is part of the evidence here. There are states like Oklahoma and Louisiana where people are making $8 or $9 an hour. That is not a living wage. And I just mentioned two states. There are many more, and the average hourly rate for nursing assistants around the country is about $12 or $13 an hour. Also, not a living wage. So we do need to address wages, but it's not the only issue, and we can't make it the only issue, because then we'll miss the opportunity to really develop a true career opportunity for nursing assistants throughout, healthcare and throughout communities. So that's really, I think, what a lot of people would say we need to do. We need to figure out how to recruit people who don't know about being a nursing assistant or don't know about being a home health aide, what that could be like and what it could mean for them in terms of a career. So we need to do more education. We need to do more with recruitment. And we need to figure out how to keep people, because we do have very high turnover, and we need to get on top of that and do a better job. So lots of work that we can all do together. Big ways we can work together and collaborate around this issue.